a little pinch. I want to go in till I just feel my resistance. And that's it. I'm going to have a mean face again. You doing okay? All right. And relax. I feel her orbital rim. And I'm going to go in here. And I'm going to do my 7 units. And then mean face again. And relax. For my orbital rim. Relax. You're pulling on that. Thank you. I usually line up my syringe so that it's in the, the way that I'm going to actually inject my patient. Mean face, relax. I'm going to feel my orbital rim. Just do 2 units. Come around this way. Mean face, relax. And when you're doing this, I would definitely look to make sure that you try and identify the veins, because if you get a bruise, it's going to last for a week or so. And if you could avoid that, you'd like to. I'm going to have you to smile and relax. A few pinches. Now, sometimes people will use longer needles in this area and just put 1 needle in and wrap it around. I just found my patients were a little uncomfortable with the big needle coming at their face, so I tend to use the small one. That's true. Okay.